Right now, there is an organ inside your body running over 500 separate chemical processes simultaneously. Not your heart, not your brain, your liver. A single dark red organ sitting behind your right rib cage, roughly the size of a football, performing more functions than any other organ in the human body, filtering your blood, manufacturing proteins your body cannot survive without, converting food into fuel, producing bile that breaks down fat, neutralizing every toxin, every drug, every alcohol molecule, every chemical you consume. Your liver is not one thing. It is a biological factory running 500 jobs at once, 24 hours a day without rest. And here is what most people do not know. It does all of this in complete silence. No nerve endings that register pain, no early warning signals, no alarm system. Your liver can lose 50% of its functional tissue and you will feel nothing. You will go to work, you will eat dinner, you will sleep, and your liver will be quietly failing while your body shows nothing. By the time symptoms appear, the damage is already catastrophic. 800 million people worldwide currently live with some form of liver disease. 1 in 4 adults on Earth has fat accumulating inside their liver right now, most of them completely unaware. It is the fastest growing cause of liver transplant need globally, and it is being driven almost entirely by everyday choices made at the table, on the couch, and in the kitchen. Today, BodyCode decodes the complete biology of your liver. Not opinion, not wellness content, the biology. To understand how the liver fails, you first need to understand what it is built from. Your liver contains approximately 80 billion cells. The primary workers are called hepatocytes. They are among the most biochemically active cells in the entire human body. Each hepatocyte is simultaneously processing nutrients arriving from your gut, manufacturing proteins, producing bile, neutralizing toxins, and regulating blood sugar levels. One cell. All of that at the same time. The liver receives blood from 2 separate sources simultaneously. The hepatic artery delivers oxygenated blood from the heart. The portal vein delivers nutrient-rich blood directly from your intestines. Everything you eat passes through your liver before it reaches the rest of your body. Your liver sees everything first. Every meal, every drink, every drug, every chemical. It is the mandatory checkpoint between your gut and your bloodstream. Inside the liver, blood flows through microscopic channels called sinusoids, tiny corridors lined with hepatocytes on both sides. As blood moves through these corridors, the hepatocytes reach in and pull out what needs to be processed. Nutrients get converted, toxins get neutralized, waste gets packaged for removal. The average human liver filters approximately 1.4 liters of blood every single minute. There is also a second population of cells in the liver called Kupffer cells. These are the immune soldiers, specialized macrophages that patrol the sinusoids, detecting and destroying bacteria, viruses, and cellular debris arriving from the gut. Your liver is not just a chemical factory, it is also a frontline immune organ. And running through all of this is the biliary system, a network of tiny ducts that collect bile produced by hepatocytes and carry it to the gallbladder for storage, then to the small intestine where it breaks down dietary fat. This is the architecture of the organ most people ignore entirely. Now, here is where it begins to break down. Liver disease does not happen overnight. It follows a precise biological progression, 4 stages. And the terrifying part is that stages 1 and 2 produce almost no detectable symptoms in most people. Stage 1, steatosis, fat accumulation. This is where it begins. When the liver is overwhelmed by excess calories, fructose, alcohol, or metabolic dysfunction, Fat molecules called triglycerides begin accumulating inside hepatocytes. The cells become engorged, they swell. A healthy liver cell looks clean and organized. A steatotic liver cell looks bloated, filled with fat droplets displacing normal cell structures. At this stage, the liver still functions, it compensates, it adapts. You feel nothing. But the fat creates a new problem. Fat inside liver cells generates oxidative stress. Unstable molecules called free radicals begin damaging cellular structures. Stage 2. Steatohepatitis, inflammation. The Kupffer cells detect the oxidative damage. They respond. The immune system activates inside the liver itself, sending inflammatory signals, recruiting more immune cells, flooding the tissue with cytokines. This is non-alcoholic steatohepatitis, NASH, in people who do not drink heavily, or alcoholic steatohepatitis in those who do. The mechanism is different, the destruction is the same. At this stage, liver enzymes begin leaking into the bloodstream. A blood test would show elevated ALT and AST, the first chemical fingerprints of liver damage. But most people are not testing. Most people still feel fine. Stage 3, fibrosis. Scarring begins. Sustained inflammation triggers the liver's repair mechanism. Specialized cells called hepatic stellate cells activate. Their job is to lay down scar tissue, collagen fibers, to patch the damaged areas. In short-term injury, this is protective. In chronic injury, it becomes catastrophic. The scar tissue accumulates. It stiffens the liver. It compresses the sinusoids. Blood flow becomes restricted. Hepatocytes begin losing oxygen. More cells die. More scar tissue forms. A cycle begins that feeds itself. Stage 4, cirrhosis, irreversible damage. Large portions of functional liver tissue have been replaced by permanent scar tissue. The liver shrinks. Its surface, once smooth, becomes nodular and hard like cobblestones. Blood cannot flow through normally. Pressure builds in the portal vein. Veins in the esophagus and stomach dilate dangerously. They can rupture without warning. Ammonia reaches the brain, causing confusion. The abdomen fills with fluid. Jaundice appears. At cirrhosis, there is no reversal, only management. The liver is the only organ in your body that can completely regenerate healthy tissue if the damage is caught early enough. 50% of your liver can be surgically removed, and it will regrow to full size within months. But once cirrhosis sets in, that regenerative capacity is gone. This is the organ you are not paying attention to. The question is, what drives liver disease in people who believe they are living normally? Number 1, fructose, the hidden liver killer. Not sugar in general, fructose specifically. Glucose, the basic sugar, is metabolized by every cell in your body. Your muscles use it, your brain uses it. The metabolic load is distributed. Fructose is different. Fructose can only be metabolized by the liver. Every gram of fructose you consume, from fruit juice, high fructose corn syrup, sweetened beverages, processed foods, goes directly and exclusively to the liver for processing. The liver converts it to triglycerides, fat. Those triglycerides accumulate inside hepatocytes. The average American consumes approximately 55 grams of fructose per day. A single large sweetened beverage contains approximately 25 grams, arriving in the liver within minutes, with no fiber to slow it. Number 2, alcohol, direct hepatocyte destruction. Alcohol dehydrogenase converts ethanol to acetaldehyde, a molecule that is directly toxic to liver cells. It damages mitochondria, it binds to proteins and disrupts their function. Acetaldehyde dehydrogenase converts acetaldehyde to acetate, but this second conversion cannot keep pace with heavy or chronic alcohol consumption. Acetaldehyde accumulates. Hepatocytes die. There is no safe threshold for liver-specific damage from alcohol. Even moderate, consistent drinking, 2 drinks per day, has been shown to accelerate fibrosis progression in people who already have fatty liver disease. Number 3, visceral fat, the metabolic driver. It is hormonally active tissue that releases inflammatory cytokines directly into the portal circulation. That blood goes straight to the liver, a continuous low-grade inflammatory signal every minute of every day. This drives Kupffer cell activation. It drives fibrosis. Number 4, ultra-processed food, the compound assault. Refined carbohydrates that spike insulin and drive fat creation inside liver cells. Industrial seed oils that increase inflammation. Emulsifiers that disrupt the gut microbiome and increase intestinal permeability, allowing bacterial fragments to leak into portal circulation and trigger Kupffer cell activation. No single ingredient, a compound assault, arriving 3 times a day. Number 5, sleep deprivation, the overlooked driver. During sleep, the liver performs critical repair and metabolic reset functions. Disrupted sleep suppresses growth hormone. Cortisol drives glucose production in the liver, increasing metabolic load. Studies have shown that even 6 days of restricted sleep measurably increases liver fat content in healthy adults. The liver has no pain receptors, but it does communicate through secondary signals. Symptoms most people attribute to other causes entirely. Persistent fatigue that sleep does not fix. When the liver's capacity to process ammonia is reduced, ammonia begins accumulating in the bloodstream. It creates a persistent neurological fog. You sleep 8 hours. You wake exhausted. You blame stress. You blame your schedule. The liver is trying to tell you something. Digestive discomfort in the upper right abdomen. As the liver enlarges, it begins pressing against the capsule that surrounds it. Gleason's capsule. This capsule does have nerve endings. As the liver swells, the capsule stretches. Most people dismiss this as a pulled muscle, gas, or digestive discomfort. Skin changes. A failing liver cannot process bilirubin efficiently. It begins accumulating in tissues. The whites of the eyes begin yellowing. The skin takes on a yellow cast. This is jaundice. Spider angiomas, small blood vessel clusters visible beneath the skin, appear on the chest, face, and upper arms. The liver normally metabolizes estrogen. When it cannot, estrogen accumulates and causes these vascular formations. Swelling in the ankles and legs. The liver produces albumin, the primary protein that maintains fluid pressure inside blood vessels. When albumin production falls, fluid leaks into surrounding tissue. Gravity pulls it to the lower extremities. People attribute it to standing too long. It is their liver. Pale or clay-colored stools. Bile gives stool its characteristic brown color. When bile flow is obstructed, stools become pale, gray, or clay-colored. Most people have never looked. Dark urine without dehydration. When bilirubin spills into the urine, it darkens to a tea or cola color. One of the earliest and most specific signals of liver dysfunction. Almost universally dismissed as dehydration and ignored. Your liver has been sending signals. They were never silent. They were just speaking a language most people have never been taught to read. There is a blood test that can detect liver damage years before symptoms appear. Most people have never ordered it. ALT, alanine aminotransferase, an enzyme that lives inside hepatocytes. When liver cells are damaged or dying, they release ALT into the bloodstream. Normal range is roughly 7 to 56 units per liter, but levels trending upward over years even within normal range, are associated with significantly increased risk of future liver disease. The trend matters as much as the number. AST, aspartate aminotransferase, also released from damaged liver cells, but also from heart and skeletal muscle. The AST to ALT ratio carries information. A ratio above 2 is associated with alcoholic liver disease. A ratio below 1 is more consistent with non-alcoholic fatty liver disease. GGT, gamma-glutamyl transferase, perhaps the most sensitive early marker of liver stress. It elevates years before ALT and AST begin to rise. Yet GGT is almost never included in standard blood panels. Studies show elevated GGT independently predicts cardiovascular disease, diabetes, and all-cause mortality, not just liver disease. Ferritin, an iron storage protein, but also an acute phase reactant. When the liver is inflamed, ferritin rises independently of iron status. Chronically elevated ferritin with normal iron studies is a red flag that is routinely missed. Fib4 score, a simple calculation using age, ALT, AST, and platelet count that estimates liver fibrosis without a biopsy. Below 1.3 indicates low risk. Above 2.67 indicates high risk and warrants further investigation. It takes 30 seconds to calculate, almost never mentioned in a standard consultation. Ultrasound can detect fat accumulation, enlargement, and structural changes with no radiation and minimal cost. In fatty liver, the liver appears brighter than normal on the scan. Yet studies consistently show that fewer than 30% of people diagnosed with fatty liver on ultrasound receive any meaningful intervention counseling. You can know exactly where your liver stands. Most people simply never ask. Here is the part of liver biology that is genuinely extraordinary. The liver is the only solid organ in the human body with the capacity for complete regeneration. Remove 60% of a healthy liver surgically, and it will regenerate to full functional mass within 8 to 12 weeks. Fructose elimination. Reducing free fructose intake produces measurable reductions in liver fat within as little as 9 days. Not months, 9 days. Time-restricted eating. Compressing the eating window to 8 to 10 hours allows the liver to shift from fat storage to fat burning during the fasting period. Liver fat content measurably decreases within 2 to 4 weeks. Coffee. 3 or more cups per day have been consistently associated with lower fibrosis progression, lower liver enzymes, and reduced risk of liver cancer. The mechanism involves polyphenols, particularly chlorogenic acid. Coffee does not cure liver disease, but the evidence for its protective effect is among the most consistent in nutritional science. Sustained aerobic exercise. 150 minutes per week of moderate intensity reduces liver fat content independently of weight loss. The mechanism involves increased fat oxidation in the liver. Removing the daily chemical load. Over-the-counter analgesics, particularly acetaminophen, are among the most common causes of acute liver injury globally. In a compromised liver, a toxic intermediate accumulates and causes direct cell death. Habitual use in someone with undiagnosed fatty liver is genuinely dangerous. The biology of reversal is real. Stage 1 steatosis is completely reversible. Stage 2 shows significant reversibility. Even stage 3 fibrosis has shown partial reversibility when the underlying drivers are removed consistently over time. The liver wants to heal. It was built for it. The question is only whether you give it the conditions to do so. 800 million people have some form of liver disease right now. Most of them do not know. Most of them are making the same choices tomorrow that they made today. You now know what they do not. This is BodyCode. Your body has secrets. We decode them.